Question 1 is, how would you explain to a different client that is convinced that carbohydrates cause weight gain and that they should be greatly reduced when dieting? So the body uses carbs as its main energy source, and during digestion, complex carbs are broken down into simple sugars called glucose, which are released into your bloodstream and called blood glucose. Insulin is released to help glucose enter the body's cells where it can be used for energy. And extra glucose is stored in the liver and in the muscles. Some of that is changed into fat. A low-carb diet is meant to cause the body to burn stored fat for energy, which leads to weight loss. If you're eating a lot of carbs and not exercising and being a couch potato, then yeah, carbohydrates are going to cause weight gain because those carbs that you consumed are going to be turning into fat since you didn't use them as energy. So eating the right amount of carbs will not cause weight gain, but eating too much carbs can cause weight gain. The second question is, summarize what the research has shown with regards to the various diet archetypes we discussed in class: low fat, very low fat, low carb, keto, high protein, intermittent fasting, and their impact on body composition. A low fat diet can be classified as high carbs and high protein with low fat between 20 and 35%. A very low fat diet would have between 10 and 20% fat. This diet is suggested for people with heart disease and diabetes. Studies show a decrease in body weight, body fat, and waist circumference, but results were more due to the decreased caloric intake than the decreased fat intake. For a low-carb diet, consuming 45% carbs is considered low and also showed to lead to significant weight loss and body composition changes. A low-carb diet helps with waist to hip circumference as well and decreases the risk of cardiovascular disease. On a ketogenic diet, the individual should consume around 50 grams of carbs, or 10% of their total energy intake. Utilization of ketone bodies in part outperform non-ketogenic conditions for the goal of fat loss. The ketogenic diet also increases fat oxidation. A high-protein diet can be considered 1.2 to 1.6 grams per kilogram, or even up to around 2.4 grams per kilogram a day. And if this diet's paired alongside intense training, a 2.4 gram per kilogram diet, you can see greater amount of fat loss compared to the 1.2 gram per kilogram. Protein also has the highest thermic and metabolic effect, so it takes more energy to break down to further utilize, which can help burn fats and carbs. A high protein diet is best paired alongside resistance training and can help lead to an increase in fat-free mass while decreasing body fat. Lastly, intermittent fasting diet can be an alternate 24-hour fasting followed by a 24-hour feeding period, and that causes a weight and fat loss due to decreased calorie intake. Another type of intermittent fasting is whole day fasting, which is 24-hour periods of fasting a week with 5 days of maintenance diet. And the diet shows weight loss, but not to be more effective than just eating in a calorie deficit every day. Another type of intermittent fasting is time-restricted feeding, which is fasting 16 to 20 hours a day with feeding periods of 4 to 8 hours a day. And that causes weight loss as a result of a decreased caloric intake, but studies have not noticed a significant body change, a significant difference in body composition. The third question is, what are some of the important considerations or factors that would promote a favorable body composition, one that is lower in fat mass or higher in lean muscle tissue? I really don't think there's a big difference between diets, like one being better than the other when it comes down to body composition, as long as you're hitting the daily recommended intake. for body composition, you'll really remain the same, or your body will remain the same or slightly alter. Obviously, if you're like a power lifter, you're not going to have that lean muscle, whereas if you're a runner, you will have more lean muscle. And if you're consuming more fatty foods and nutrients, then you're going to have more fat mass, unless you're exercising. Number 4 is explain the difference between an eating disorder and disordered eating, outlining potential warning signs. So disordered eating does not necessarily mean the individual has an eating disorder. The key distinction between disordered eating and an eating disorder is whether or not the person has symptoms and experiences that meet the American Psychiatric Association. People with disordered eating often experience anxiety with specific foods or even skipping meals. Their weight fluctuates often, and these individuals also have very set routines around food and exercise. People with disordered eating usually don't realize the impact on their mental and physical health, and disordered eating also can turn into a full eating disorder if the individual does not get back on a normal eating schedule of 3 meals a day with various snacks. The 5th question is explain why losing or gaining weight is not as simple as calories in, calories out. So calories in, calories out isn't the same as losing or gaining weight, because different foods have different thermic effects. Different foods also have different macronutrients, and the amount of protein, fats, and carbs are different, varying the metabolic response. Also, weight loss requires a caloric deficit, so you need to eat fewer calories than you burn to lose weight. After your body's energy requirements are met, the extra calories are stored for later use, mostly as fat, but also some in your muscles as glycogen. So consuming more calories than you burn will result in a weight gain, whereas consuming fewer calories than you require will result in a weight loss.